Hello, this is Dr. Emma Hitt-Nichols, and this is the new FDA Approvals Podcast with the latest information on the FDA approvals for the week of October 30th through November 3rd, 2023, last week. So first up, the FDA has granted approval for Pembrolizumab, Keytruda, in combination with gemcitabine and cisplatin chemotherapy for the treatment of patients diagnosed with locally advanced, unresectable, or metastatic biliary tract cancer. This approval is based on the positive outcome of the Keynote 966 trial, which enrolled 1,069 patients with this condition who had not previously received systemic therapy for advanced disease. Patients receiving pembrolizumab plus chemotherapy demonstrated a significant improvement in overall survival and had an extended median overall survival compared with placebo plus chemotherapy. Approval was granted to the manufacturer of pembrolizumab, that's Merck. Pembrolizumab is approved for multiple cancer types and was first approved in 2014. Pembrolizumab works by releasing PD-1 pathway-mediated inhibition of the immune response, which in turn improves the anti-tumor immune response. Also, last week, the FDA granted approval for Secukinumab, that's Cosentyx, as a treatment option for adults with moderate to severe hidradenitis suppurativa. I'm going to call that HS. This approval makes Secukinumab the first and only FDA-approved interleukin IL-17A inhibitor for HS, a condition that affects approximately 1% of the global population. The approval for HS is based on data from the pivotal phase 3 Sunshine and Sunrise trials, which collectively enrolled over 1,000 HS patients from 40 countries. A significantly higher proportion of patients achieved a response when treated with Secukinumab compared to placebo in both trials at week 16. Additionally, an exploratory analysis extended to 52 weeks showed further improvements in response following either dose regimen. Secukinumab, manufactured by Novartis, was first approved in 2015 and is also indicated for moderate to severe plaque psoriasis, psoriatic arthritis, and ankylosing spondylitis. Also this week, the FDA has granted approval for Wezlana, that's Wezlana, and that's also called Ustekinumab, AUUB, and that's a biosimilar that is interchangeable with Stelara for the treatment of multiple inflammatory diseases, including Crohn's disease and psoriatic arthritis. According to the FDA's news release, the approval of Wezlana is based on a comprehensive review of scientific evidence demonstrating that it's highly similar to Stelara and that there are no clinically meaningful differences between the two products in terms of safety, purity, and potency. Approval of Wezlana was granted to Amgen Inc. Now, a word from the supporter of this podcast, Nascent Medical. Is your internal medical writing team tapped out? Nascent Medical is here for you. Our team of native English-speaking MD and PhD level medical writers specializes in providing fast turnaround needs assessments, carefully annotated manuscripts, engaging slide decks, and accurate ad-board summaries in any medical specialty. Visit nascentmc.com now and get a speedy estimate between business hours, Monday through Friday, 8 to 6 p.m. Nascent Medical, because you should never be without excellent medical writing assistance. Also last week, the FDA has approved Vonoprazan, as called Voquezna, for the treatment of erosive esophagitis, also called erosive gastroesophageal reflux disease, or GERD. Vonoprazan, a first-in-class oral potassium competitive acid blocker, PCAB, provides more potent inhibition of gastric acid than proton pump inhibitors and is seen as a potential alternative to these agents. Approval is based on the Phase 3 Falcon EE study involving 1,024 patients in the US and Europe comparing Vonoprazan to lansoprazole or Prevacid for GERD management. Vonoprazan 20 mg achieved non-inferiority to lansoprazole 30 mg for complete healing by week 8. Adverse event rates were similar to those of lansoprazole. Vonoprazan, manufactured by Phathom Pharmaceuticals, is expected to be available in the US next month. This week's approval follows an approval last week of the Voquezna triple pack, and that includes Vonoprazan combined with amoxicillin and clarithromycin, and also the Voquezna dual pack, which is Vonoprazan and amoxicillin. And those are both for the treatment of H. pylori infection in adults. Also last week, the FDA has approved an expanded indication for Abatacept Orencia for the treatment of psoriatic arthritis in pediatric patients 2 years of age and older. Abatacept, manufactured by Bristol Myers Squibb, was first approved in 2005 for the treatment of moderate to severe rheumatoid arthritis and was approved for treating active psoriatic arthritis in adults in 2017. And finally, it's not an approval just yet, but an FDA advisory panel concluded last week that a CRISPR approach for sickle cell disease is safe enough for clinical use and may be approved as early as December 8th. Exa-cel, which has the name of Exa-gam-glugene autotemcel, again, Exa-cel for short, manufactured by CRISPR Therapeutics and Vertex, would be the first approved therapeutic based on CRISPR gene editing technology. That's quite exciting. Currently, there are over 250 CRISPR-based therapies in clinical trials worldwide, targeting a wide range of diseases, including several cancer types, rare diseases, and infectious diseases. The CRISPR approach involves removal of cells from patients followed by gene editing so that in the case of sickle cell disease, the cells will produce high levels of fetal hemoglobin, hemoglobin F, in red blood cells. Then they are infused back into the patients. This then restores normal red blood cell function. So while not a cure, the hope is that Exa-cel will be a one-time treatment that will alleviate symptoms of sickle cell disease for a lifetime. In a study involving 30 patients, Exa-cel alleviated symptoms in 29 patients, followed for at least 18 months, and did not appear to cause any serious short-term safety issues. Exa-cel is being evaluated in the CLIMB 141 and 151 phase 3 clinical trials in sickle cell disease and beta thalassemia, respectively. That's it for this week, and thank you so much for listening. Please do tell your colleagues about this podcast. Hopefully, if you listen to it each week on a Monday, then it will keep you up to date and help you do your job better. All right, thanks so much. Have a great week.